Welcome to The Explainer. Today we're stepping right into the high-tech diagnostic world of medical imaging to decode the prostate ultrasound. You know, when a doctor is staring intently at those stark, black and white sonographic images on a dark monitor, it can honestly look a bit like abstract art to the rest of us. But today we're going to break down exactly what they're looking for. Because, as it turns out, these visual echoes, these shadows and highlights, reveal some absolutely incredible, hidden realities of male health. Let's get into it.
Okay, let's dive into our diagnostic checklist for today. We're going to start with a quick intro to how prostate ultrasounds work, and then establish a healthy baseline by visualizing a normal prostate. From there, we'll look at benign prostatic enlargement, check out bladder changes and residual urine, spot things like cysts and calcifications, and then finally pull it all together to synthesize the final report.
So Part 1, Intro to Prostate Ultrasound.
What exactly are we hunting for when we boot up that monitor? Well, when a transabdominal ultrasound is performed on the male pelvis, the primary goal is to get a comprehensive bird's-eye view of the whole region. The sonographer scans the area right beneath a full urinary bladder to assess a few key structural elements. Think of it a bit like a pelvic weather radar, or maybe a really thorough structural inspection of a house. We're looking closely at the overall size and shape, we're evaluating the visual pattern of the tissue itself, and we're checking for any changes in the bladder. Having this broad scope is what allows clinicians to identify the whole shebang, everything from harmless benign enlargement all the way to cysts and calcifications.
But before we can spot what's going wrong, we absolutely need to know what right looks like. That brings us to Part 2, visualizing a normal prostate.
When analyzing a healthy prostate, clinicians are looking for something called echo texture. I know it sounds like heavy medical jargon, but it's really just the term for the visual pattern or the texture of the tissue that's created by those bouncing sound waves. A totally normal prostate should look relatively homogeneous. You shouldn't be seeing jagged edges or wildly varying textures. Instead, it's going to display a really consistent, even visual pattern with a nice, smooth, continuous outline. It just sits there, perfectly content, right beneath the urinary bladder.
Now, to actually confirm it's healthy, the sonographer has to measure it. In a real exam, you'd see these little digital calipers pop up on the dark screen, mapping out the gland in 3 dimensions. Step 1, they measure the width. Step 2, the height. And Step 3, the length. By grabbing these 3 specific dimensions, the ultrasound system can automatically calculate the approximate volume of the prostate. And boom, that gives us our perfect healthy baseline to work from.
So what happens when that baseline starts to shift? Let's move into Part 3, Benign Prostatic Enlargement, or BPE.
The contrast here is actually pretty staggering when you see it side by side. On the one hand, you have that normal prostate, smooth contour, homogeneous echo texture, looking great. But on the other hand, we see one of the absolute most common clinical findings that ever pop up on the monitor, benign prostatic enlargement. The visual shift is dramatic, right? The overall volume of the prostate is just noticeably increased. And specifically, what you're seeing is an enlargement of what's called the transition zone of the gland. Now, here is where it gets really interesting, the physical consequence of that enlarged transition zone. The enlarged gland actually projects upward, literally pushing into the space of the urinary bladder. It's not just sitting there quietly anymore, it is actively intruding. And this physical intrusion is a huge deal because it's closely associated with a physical blockage that clinicians call a bladder outlet obstruction.
Which kind of begs the question. The prostate isn't existing in a vacuum, right? It is wedged right up against the urinary tract. So, how does this localized, specific enlargement end up affecting the rest of the surrounding anatomy?
To answer that, we're moving to Part 4 of our diagnostic journey, bladder changes and residual urine.
Because the enlarged prostate is physically narrowing the bladder outlet, the urinary bladder suddenly has to work significantly harder just to empty itself. And this secondary, structural change, it's highly visible in the sonogram as a thickening of the bladder wall, a condition known as trabeculation. Trabeculation is essentially the physical strain on the bladder wall muscles. It's what happens when they have to desperately fight against that narrowed outlet day in and day out. You're looking at stark, visual evidence of the bladder literally struggling to do its job.
So the crucial takeaway here is that we have to measure just how effectively the bladder is managing despite this obstruction. To figure this out, the sonographer scans the bladder before the patient empties it, and then, you guessed it, scans it again right afterward. This lets them measure the increased post-void residual urine, that's just the fluid left behind. Documenting this residual volume is an absolutely vital part of the exam because it tells us the true severity of that physical blockage. It's the so what of the whole situation.
Aside from structural enlargement, sonographers are also actively scouring the tissue for secondary visual anomalies. Which brings us to Part 5, spotting cysts and calcifications.
When we're scanning the monitor, we might stumble across two very distinct types of focal abnormalities, and they look completely different from one another. Prostatic calcifications, they show up as these bright, glaring spots, clinically referred to as bright echogenic foci. Because sound waves literally cannot pass through these dense little stones, they often leave a dark, shadowy trail right behind them, which is known as posterior acoustic shadowing. Now, cysts are the exact opposite. They appear as very well-defined, smooth lesions that are completely 100% anechoic.
Let's actually unpack that term for a second, because anechoic is a massive staple of ultrasound imaging. It literally means appearing entirely dark on the monitor. Remember, an ultrasound works by listening for bouncing echoes. Well, a cyst is just a fluid-filled structure, so those sound waves travel right through it without bouncing back at all. No echoes means absolutely no white pixels on the screen. So a cyst is going to present as this well-defined, pitch-black void sitting right there within the gray tissue of the prostate.
Okay, so once the sonographer has mapped the dimensions, noted the echo texture, and hunted down any bright calcifications or dark anechoic cysts, the scanning part is over. Now comes Part 6, our final step, synthesizing the final report.
All of those visual measurements and sonographic anomalies we just talked about, they are methodically compiled into a highly actionable medical document. The final professional report is essentially a master checklist. It formally documents the prostate dimensions and overall volume. It notes the homogeneous or heterogeneous nature of the echo texture. It logs whether there's any median-low protrusion into the bladder. It records the exact location of focal abnormalities, like those calcifications or cysts. And crucially, it details the urinary bladder findings, including wall thickness and the exact volume of that post-void residual urine.
But, and this is absolutely vital to remember, data on a dark screen is really only half the story. The clinical guide leaves us with this mandate: always interpret ultrasound findings together with the patient's symptoms and clinical evaluation. All of these complex, high-tech visuals, the volumes, the trabeculation, the anechoic voids, they honestly only matter when they are anchored back to reality. They are tools to help diagnose and explain a real patient's actual lived experience and daily symptoms.
Which leaves us with a pretty fascinating thought to end on. We've seen how effectively these high-contrast sound waves can map out our internal architecture, literally turning a stark monitor into a window of diagnostic truth. If these visual echoes can so clearly reveal the hidden sources of our physical symptoms, how might understanding this diagnostic journey change our own approach to aging, bodily awareness, and proactive health? Something to think about for sure. Thanks so much for joining me on this explainer, and keep asking questions about the hidden systems that keep us moving.